Welcome back to my channel Medicine of 101. Today we'll talk about peptic ulcer disease, okay, from the gastrology. So before starting the topic, let's define the term. What do we mean by peptic? Peptic means basically it means stomach, right? And what do we mean by the ulcer? Means we can get the sore, or you can say the breakdown within the membrane, breaking of the membrane. Whenever we get the damage within the membrane, we will get the breakdown of the membrane. So you can write it over here, whether it will be sore or break, okay, down of membrane. That means whenever we will get the breakdown of the membrane, okay, it may be the the ulcers that may be present within the stomach, as well as it may be present within the small intestine. Within the small intestine, basically we will get the within the duodenum. So whenever we will get the sore, okay, or the breakdown of the membrane within the stomach, that is known as what? Gastric ulcers. And whenever we will get the presence of the sore or breakdown of the membrane within the duodenum, that is known as duodenal ulcer. So let's define the term over here. So whenever we will get the having on or more sore or breakdown of the membrane within the stomach, that is regarded as gastric ulcer, right? And whenever we get the having sore, okay, let's write it over here clearly, or having on or more sore down of the duodenal membrane over here, where within the duodenum, that is known as duodenal ulcer. Duodenal ulcer, okay, it's clear for you. Now, as far as the structures is concerned, as we know, within the stomach there is a presence of mucosal layer. There is presence of mucosal layer. Now, within the mucosal layer, we will get the three types of the layers. Within the mucosa, we will get three types of the layers. So, if I just define the, I am just taking the mucosal layer from here. I am representing the mucosal layer over here. Okay. Now, within the mucosal layer, if we will get the three individual layers. The inner, if we just see over here, that the innermost layer will get over here. The innermost layer will get the what? There is a presence of epithelial cell. So is the epithelial cell. What is the function of these epithelial cells? Basically, it does the what? Absorption and secrete the different kinds of the digestive enzymes. So you can write it over here: absorption and secretes different kinds of the digestive enzymes. In the mid, we are getting over here the another layer that is known as Laminar Propria. So first we are getting the epithelial layers, then we are getting the Laminar Propria. Within the Laminar Propria, basically we will get the blood vessels and the lymph. Within the Laminar Propria, we will get the blood vessels and lymph. You can see the blood vessels over here. So these layers, that is known as Laminar Propria. So Laminar Propria. Here we will get plus we will get the lymph. Now the outermost layer we will get over here. There is a smooth muscles layer. From the here it's easy to understand is these are the what is smooth muscles. So this is smooth muscles. What they will do? They will do the what contractions, and by doing the contractions, they will help to break down the foods. Okay, we can write it over here. This is the smooth muscles layer. This is the smooth muscles layer. What it does, by contraction, right? Contraction, it will have to break down the food. Breakdown of food particles. Okay. Now this is the layers. Within the mucosal layers, we will get this type of the structures. Now, if I show over here that what about the different kinds of the cells are present in the different places of the stomach. Now, on the basis of that, on the presence of the cells, okay, based on these things, we can just divide the stomach in the four regions, right? As we know, and from here to here, these regions, this is known as cardia. This is the cardiac region, so we can say cardia. After that, okay, we will get a portions. Let's define this one with a different color. We will get another layer. This is known as fundus. Then we'll get to what? This is the body of the stomach, right? This is the body. So for example, we're getting over here, from here to here we're getting the body, and from here to here, for example, we are getting the pyloric or the antrum regions. So pyloric or antrum. Okay. Now we'll talk about in details about the each places. At first, if you talk about the cardia, within the cardia, basically we'll get what? The presence of the foveolar cell. So let's write it over here and classify them. Okay. So first things we're getting over here, the within the cardia. Within the cardia, we'll get the presence of the foveolar cell, and these foveolar cells, they secrete the mucus plus protein fluid, glycoprotein rich fluid. We can write it over here. Okay. Now this mucus will get over here, that is having the glycoprotein plus outer molecules. Okay, so the foveolar cells, they are responsible for the secretion of mucus and the what? Glycoprotein. Okay, the mucus that is made up of the glycoprotein outer molecules. Okay, now we'll talk about the second layer. Second layer, what we are getting the fundus over here. So what type of the cells we'll get within the fundus? Okay, let's talk about those things. Then we'll go over here. Now see, okay, let's write it over here, and I think it will be easier for you. Within the fundus, or we can say the body, these regions, we'll get presence of the two types of the cells. One cell will get over here within the what? Fundus, or we can say the body, will get the presence of parietal cell, and these parietal cells are responsible for the secretion of hydrochloric acid, HCl. And another kind of the cells will get over here, that is known as chip cell. Chip cell. And chip cell is responsible for the secretion of one kind of the enzyme that is known as pepsinogen. And this pepsinogen that will help to digest the protein. Okay. So we'll get the pepsinogen. And this pepsinogen, as we know, it will help for the digestion of protein. And the parietal cells that will secrete the HCl. Now another type of the thing we'll get over here, I just did combinations of the fundus and the body for as we will get the two same kind of the cells over here. And the last regions, we can say the pyloric and the antrum regions. In this case, we'll get the presence of G cell. So let's write it over here. Within the pyloric or antrum regions, we'll get the presence of G cell. Now these G cells is responsible for the secretion of gastrin. And what is the function of the gastrin? This gastrin that can activate the parietal cells to release HCl. So at first, let's know about these things. Within the pyloric regions or the antrum regions of the stomach, we'll get the presence of the G cell. And the G cell that will secrete the gastrin, and this gastrin that can stimulate the what? The parietal cells to release HCl. So parietal cell, it will stimulate the parietal cell and we will get release of the HCl. Okay. So these are the different kinds of the layers and the different kinds of the cells are present over there, and we will get their functions. Along with that, see, we will get within the duodenum there is the presence of Brunner's gland. Within the duodenum we will get the presence of, for example, so over here we will get the Brunner's gland. Okay, if I say over here, okay, this regions within the duodenum we will get the presence of Brunner's gland. What is the function of the Brunner's gland? It is responsible for the secretion of mucus plus bicarbonate ion. Mucus plus bicarbonate ion. Now try to understand, when you are saying over here that the Brunner's gland is responsible for the secretion of the bicarbonate. Okay, as you know that within the stomach there will be secretions of acid, and whenever we get the acid flow from the stomach to the duodenal regions, and this whatever the acid that will be produced by the parietal cells within the stomach, that will be neutralized by the productions of what? The bicarbonate ions that will be produced by the Brunner's gland that is present within the duodenum. This is a normal thing. Now see, As the stomach, the mucous layers of the stomach is always exposed to acids. This, try to understand this word. These are mucosal layers of the stomach that is always exposed to acids. That means always exposed to acid. As a result, we will get the thicker mucous layer within the what stomach. That means we will get the thicker mucous layer than the what? The mucous layers within the duodenum. That means in a nutshell we can say within the stomach there will be the presence of thicker mucus layer than the what? Duodenal mucus layer. If it's clear for you. Now we'll go to the different kinds of the causes and what can cause the ulcers over here. Before that, one more important thing that you're supposed to know, that the prostaglandin, another molecule we can say over here, the prostaglandin, as we know, let's write it over here. This prostaglandin activate these cells within the stomach, and this prostaglandin stimulate the secretion of mucus and bicarbonate. So one function of the prostaglandin we are getting over here, it stimulates the secretion of mucus and bicarbonate. Another thing from the basic knowledge we know that prostaglandins are basically they are vasodilators, right? They are dilators. So by the action of the vasodilations, we will get the more amount of the blood flow. So whenever we get the more amount of the blood flow, as a result we will get more amount of the bicarbonates, more amount of the mucus. So another thing we can write it over here about the prostaglandin, that by the action of the vasodilation, we'll get over here that more blood flow. Whenever there will be more blood flow, try to understand there will be more bicarbonate. We'll get more mucus that will support the mucosal layer of the stomach. Another thing over here, this prostaglandin that can also inhibit the acid secretion. This prostaglandin that can inhibit the acid secretion. Another thing over here, this prostaglandin also give stimulus to the epithelial cells for the growth. So that can also stimulate for the growth of epithelial cell. Now we'll go to the origins of the etiologies as far as the peptic ulcer disease is concerned. So what are the causes that can cause the peptic ulcer? Let's talk about those things first. So the causes or the etiology, whatever you can see here. The first cause you can write it over here. That's the H pylori, Helicobacter pylori. Okay. So H pylori, what it will do? Okay. As we know, it's the gram-negative bacteria, right? It is the gram-negative bacteria. Now, this H pylori, whenever it may be ingested through the foods or the different kinds of the, as you know, in terms of the microorganisms over here. So what it will do, this H pylori bacteria over here, this gram-negative bacteria, that will just do the colonizations where within the mucosal layer of the stomach. So whenever we get the colony formations of the H pylori, where within the mucosal layers of the stomach as well as within the mucosal layer of the duodenal also. Now here we write this H pylori, what they will do, they will form the colony, or you can say the colonization of H pylori, where within the mucous layer, and whenever we will see, they will come over here, they will secrete the molecule, they will secrete the adhesions molecule, and whenever they will secrete the adhesions molecules, what they will do, they will be able to get stuck along with the cardiac regions of the stomach. So that's over here. So after colonizations, we will see this H pylori, they will secrete this molecule by which they will get stuck along with the the cardiac regions of the stomach. And along with that, they are also able to secrete the protease enzyme, by which they will break down the membrane of proteins. we can write the breakdown of membrane. Now if you see this type of the thing for long period, okay, H pylori initially will not get any kind of the symptoms for these things. But if you see this type of the thing long lasting or long standings of the attacking of the H pylori, as a result we will see this H pylori that will keep on damaging like this way. Ultimately we will get there will be formations of hole, rather you can say there will be the development of ulcers. So when you will get the ulcers from the H pylori, if we get for the long standing regions, long standing, okay, or long lastings attacking of the H pylori over here, as a result we will get the ulcers. And sometimes we will see over here that try to understand H pylori that will keep on attacking, for example within the duodenal regions as well. Here we will get the formations of the hole, okay, formation of the hole. Ultimately we will get also that the bleedings will get the bleeding whenever they will just keep on the attacking over here, this membrane that will go slashed totally. So as a result we can also get the bleeding over here. What are the second regions that can cause ulcers over here? The using of the non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. So whenever an individual who is using the non-steroidal anti-inflammatory drugs for a long time, whatever the thing will get, as we know the non-steroidal anti-inflammatory drugs, they can inhibit the cyclooxygenase enzyme whenever they are able to oxygenase enzyme. And as we know the cyclooxygenase enzyme that is able to produce the prostaglandin, right, from the basic pathology, prostaglandin. And this prostaglandin, what it will do, this prostaglandin that will inhibit the acid secretion. As I already mentioned over here, this prostaglandin, try to understand. First, let's talk about the normal functions of the cyclooxygenase. This cyclooxygenase is responsible for the productions of the prostaglandin, and this prostaglandin is able to inhibit the acid secretion. As this prostaglandin that is also able, try to understand over here, that for the growth of the epithelial cells over here. Okay. Now the second thing is over here that the prostaglandin is also responsible for the secretions of the mucus and the bicarbonate. So what did I say you? That the prostaglandin that can inhibit the acid secretions, as well as the prostaglandin that is also responsible for the secretions of the mucus bicarbonate, and the prostaglandin that is also responsible for the growth of the epithelial cells over here. Now, whenever any individual who is using the NSAIDs, or you can say the non-steroidal anti-inflammatory drugs, here we will get the inhibitions of the cyclooxygenase enzyme. So whenever the COX that will be inhibited, definitely the prostaglandin production that will be also inhibited. Now whenever the prostaglandin production, understand these mucosal layers of the stomach that will be exposed to acids. Okay, so you can write it over here that the mucosal layer that will be exposed to acid. As a result, we can get the development of the ulcers over here. For the long lasting, that's why I did mention about this thing, that whenever any individual who is taking the non-steroidal anti-inflammatory drugs for longer period, in these cases will get that will be inhibited. Definitely the prostaglandin production that will be also severely dropped. Ultimately will get the the inhibitions of this whole thing. As a result, we will get the mucosal layers of the stomach that will be exposed to acids. Okay, so there is no fun in telling about these things. What are the third regions? The third regions over here we can get the Zollinger-Ellison syndrome. So Zollinger-Ellison syndrome. So what are the thing we will get over here? In these cases, basically we will get the productions of the tumor, right? We will get the production of the tumor. Basically, you will get the tumors within the first regions of the duodenum. Whenever we are talking in terms of the Zollinger-Ellison syndrome, in these cases, we will get production of neuroendocrine tumor where within the first regions of the duodenum. In these cases, basically the tumor is what? The gastric tumor, or rather you can say the gastrinoma. We'll get the gastrinoma. So whenever you are getting the gastric tumor or a gastrinoma, this gastrinoma, they will secrete huge amount of the gastrin. And as I said you before, this gastrin that is responsible for the activations or the stimulations of the parietal cells to release more amount of the HCl. So here we'll get the parietal cell that will be stimulated. As a result, the productions of the too much of the HCl. Ultimately, the more amount of the HCl, try to understand the more amount of the HCls, okay, that will be secreted over here. So ultimately, the mucosal layers of the stomach, or you can say the mucosal layers of the duodenum, that will be damaged totally. So ultimately, you will get the development of the ulcers. Okay. Now, see, what about the diagnosis? How can you just do the diagnosis over here? Okay. So as far as the diagnosis is concerned, what can we do? Let's talk about the diagnosis right now. Okay. Where can I just erase some portions from you guys? So, as far as the diagnosis is concerned, okay, let's talk about those things over here. Then I think it will be easier for you to understand in this place. So, as far as the diagnosis is concerned, what can you do? First thing we can do over here, the upper endoscopy. Upper endoscopy, where we can get the which portions is getting involved over here. The second thing we can do over here, we can just do the biopsy. When you are doing the biopsy, in these cases, we can rule out the presence of the malignant cells, because when you are doing the biopsy, in these cases, we can detect whether there is a presence of malignant cells or not. Or along with that thing, we will get over here to able to rule out the signs of H pylori. H pylori. Okay, so as far as the diagnosis is concerned, we can first do the upper endoscopy. The second thing, we can just, for the better understanding, we can do the biopsy. We are able to detect whether there is a presence of the malignant cells or not, or we can also know the signs of the H pylori. Now we'll go back to the treatment. Now, as far as the treatment is concerned, what can we do over here? Now, if you are able to suspect that the individual, we are getting confirmations by doing the testing that yes, the individual is from the ulcers, and that is caused by the H pylori. So whenever we get the H pylori, in these cases, we have to use the combination of the drug. Which type of the drugs we can use over here? We have to use the proton pump inhibitor. Sorry. Along with that, we can use the antibiotics. We have to use the 2 antibiotics, and we have to use also the proton pump inhibitor. This is also known as triple drug therapy. From the basic pharmacology, I think you know it, guys. So we can use the combination of drugs. Okay, in these cases, in terms of the proton pump inhibitor plus antibiotics. Now, if we say normally that if the individual is not affected by the H pylori, in these cases we have to use the proton pump inhibitors. The proton pump inhibitor in terms of the, write it over here, omeprazole, esomeprazole, lansoprazole, all these things you can use over here, and you can keep the dose over here. For the adults, you can use for the 500 milligram, 2 times you can use. Okay, as far as the dose is concerned. Now, if we see this, if the case is severe, for example, if we get the presence of the tumor, for example, the gastrinoma over here we are getting, in these cases, if we get the size of the tumor is more than 2 or 3 centimeter, so whenever we get the size of the tumor is more than 2 or 3 centimeters, in these cases we are supposed to go for the surgery. So when you will go for the surgery, whenever we get the size of the tumor is more, or if we get this type of problem over there, then we are supposed to go for the surgery. Now see, as far as the gastric ulcer is concerned, so what is the most common site for the formation of the gastric ulcer? The most common site where you can get the development of the gastric ulcer, that is the lesser curvature of the stomach. So lesser curvature of the stomach. And as far as the duodenal ulcer is concerned, the most common site is the first regions of the duodenum. Okay, these are the main regions. Now, out of the symptoms, how can we just differentiate in between the the gastric ulcers and the duodenal ulcers? Okay, let's talk about that thing first. Okay, let's continue. So if we can just do the differentiations in between the gastric ulcers as well as the duodenal ulcers. So one thing over here, as far as the different kinds of the symptoms is concerned, what type of thing we'll get? The first things we'll get the epigastric pain. We'll get the pain here within the epigastric regions. So as far as the symptoms is concerned, we'll get the epigastric pain. Along with that, if we get over here in terms of the, try to understand in terms of the gastric ulcer, what type of thing we'll get. So whenever the individual is taking food, try to understand whenever the individual is taking food, by the different kinds of the mechanisms of the hormonal mechanisms, will get the secretions of the H cells. So whenever in terms of the gastric ulcers, whenever the individual is taking food, as a result will get the productions of the H cells, and at that time the pain will be severe. That's why the individual will always think about not to take food, because whenever the individual is taking food, at the time these parietal cells are getting activated or stimulated. As a result, they will secrete the H cells, and whenever the H cell will be produced, is a normal thing. Yes, the individual will feel pain. That's why the individual will always think not to take food. That's why in these cases we'll get the weight loss. And what about the duodenal ulcers? The duodenal ulcer will get the opposite thing. In duodenal ulcers, try to understand in these cases, whenever the individual will take food, at the time the individual will feel relief. Okay, so during eating food, it will be okay. Okay, that's why we will get in these cases the weight gain. So how can we just differentiate over here? In terms of the, try to understand in terms of the gastric ulcer, whenever the individual is taking food, will get the productions of the H cell. As a result, the individual will feel pain over here. That's why the individual will think not to take food. That's why we'll get the weight loss. In the second case is in terms of the duodenal ulcers, whenever the individual is taking food, at that time the individual will feel relief. Okay, he will feel better. As a result, we'll get the weight gain. Now these are the different kinds of the differentiation as far as the symptoms is concerned of the both. You can see over here in terms of the gastric ulcer and the duodenal ulcer. So that's all for today in terms of the peptic ulcer disease. If you have any questions, if you don't get any point related to the videos, please let me know in the comment sections. I'll read your comment, guys, and I'll try to help you. Okay. So thanks for watching. See you in the next video very soon with the new topics in industry. Thanks for watching.